Let's summarize the sequence of events as indicated by the numbers on this concept map, remembering that the original stimulus for this sequence of events was a decrease in blood pressure. So number 1 indicates the baroreceptors at the carotid sinus and also at the aortic arch. These receptors are then going to send afferent signals to the cardiovascular control center in the medulla, and this is acting as the integrator. It will then send out efferent signals. Let's look at the two branches of the autonomic nervous system, the sympathetic and parasympathetic. First of all, there will be an increase in the sympathetic output going to the SA node. This is going to be where the autorhythmic cells are. These cells have beta-1 adrenergic receptors, and the response is going to be to increase their rate of depolarization, to increase their rate of firing, and to increase heart rate. Sympathetic input also increases and goes to beta-1 receptors again on the myocardial contractile cells. This will increase the force of contraction and increase stroke volume. Sympathetic output also increases and goes to the veins. This is going to cause constriction of the veins, increasing the amount of blood returning to the heart, increasing the venous return, increasing the preload. This, in effect, has the response to increase end diastolic volume, increasing the maximum amount of blood in the heart, in the ventricles, and this is going to cause stretch, and according to Starling's law, will also increase stroke volume. The combination of increased heart rate and increased stroke volume will have the overall effect of increasing cardiac output, and as we know, increased cardiac output will then increase blood pressure. This is exactly the response that we would expect. If the stimulus is a decrease in blood pressure, we would expect the response to be an increase in blood pressure. The only point here that I missed was the antagonistic control. If we have an increase in the sympathetic nervous system, we are going to have a corresponding decrease in the parasympathetic nervous system. That's carried by the vagus nerve, and you can see here that there is actually a decrease in parasympathetic stimulation of the SA node. The autorhythmic cells have muscarinic receptors that are going to be binding the acetylcholine, and because of the decreased stimulation, these cells will not be responding in the way that they normally would be, which would be to decrease heart rate. So once again, decreasing the parasympathetic, like taking your foot off the brake, is going to increase heart rate.